Hi, everyone. Welcome back. Today, we are joined by Dr. Eddie Stenehjem, an infectious disease physician here at Intermountain. And we're just going to be giving our COVID-19 update for the last week to kind of check in on how Utah is doing. Eddie, thank you so much for joining us.
Thanks, Amanda. Thanks for having me back.
Yeah, so as of April 15th, which was Wednesday, the Utah government site is reporting 2,683 cases in Utah. Are we still seeing a normal rate of positive cases come in, or has there been a decrease or increase in that rate?
Yeah, we're actually seeing, when you look at all test comers, the rate of positivity is still about 5%. And that's been pretty consistent over the course of this epidemic and hasn't changed all that much. And so we're still seeing right about 5%. Our case counts, so remember, his data is a couple days behind. And so the data we have is reflective of the from most updated data from Wednesday, shows that the curves are relatively flat. We are seeing, positive cases in the realm of 100 to 150 cases per day. There's some fluctuation in that. The last 3 days that we've seen reporting, we've seen significant increases in cases. But yet, when we look at the whole trajectory of the curve, it looks relatively flat.
And why do you think that case increase has kind of happened? What went on in Utah that could have been something to contribute to the case increase that we're seeing?
Yeah, it's something we always try to speculate about when we start seeing an increase in cases. And what you do is you look back 4 to 5 days from when you're seeing those positive cases, because the incubation period for this virus on average is 5 days. And if we look back 5 days, that put us squarely in the Easter weekend. And there is some speculation that social distancing may have got a little lax. People started congregating with friends and family for the Easter weekend, and we're now potentially seeing that effect of increases in cases due to that lack of social distancing. Again, that's speculative. We don't have any hard data to actually suggest that's truly the case, but you really got to wonder about that when you start seeing data like this.
Yeah, I think that also brings up the next point of, are we successfully flattening our curve, and is social distancing actually working? It sounds like
Right.
from what you just said that it is, but we need to keep doing it.
Yeah, I think, we're getting now enough data for us to kind of make that determination. And if you look back to around April 1st, you really saw that data, those numbers going way up. And there was an inflection point around that first week of April where things have flattened out, which is exactly what we wanted. The last thing we wanted was those cases to keep going up, and then we are not able to care for those patients in our hospitals. And so our curve is flat, and that is incredible. That is exactly what we wanted. We wanted our communities to come together, really limit our social, or really increase social distancing, limiting our gatherings, decreasing those transmissions, and that's what we're seeing. And our curve is flat, but it should be really emphasized, our curve isn't zero. We're still seeing 100 to 150 new cases per day. Intermountain still has over 50 patients in the hospitals per day with this infection. We still have people dying across the state from this infection. So by no means are we on the other side of this.
Yeah.
All what we can say now is that our curve is flat. Our healthcare capacity is good. We have enough supply of personal protective equipment for our healthcare workers, but I can't say with any determination, how long we'll remain in this period where that curve is flat.
Yeah, so that brings up my next point too. The weather is warming up now. It's almost May, which is crazy. And more people are starting to head outside. Why is it so important that we keep social distancing? What happens if we all decide to just forget that we're supposed to be doing this
Right.
and start living our normal from a few months ago?
Right. It's an incredibly relevant question right now. We're seeing this in the news. We're seeing governments talk about it. We're seeing states talk about it. When do we reopen? When can we go back to kind of life as we knew it pre-COVID? And in reality, we don't know. We have to let the data drive this. We can't get emotional about this. We can't be reactive to this. We really have to be driven by the data. And at this point, we're still seeing lots of cases. This virus is still circulating in our community. Now is not the time to be reopening. Yes, it is nice out. It's May. It feels great. This is, something we all need from a mental health standpoint, is to get outside. but we can get outside and still be safe. And it's incredibly important that we remain socially distant, even if we are outside. So if you're going out to hike on our trails, using trails that are not well used, getting away from crowds, not going hiking or biking or doing these things in big groups,
Mhm.
maintaining your distance as you pass each other on the trail. All of that couldn't be more important now than before. And what we worry about, and it's a very significant worry, is that if we don't do this, if we limit our social distancing, we start going back to what it was, we're going to see increased cases. Period.
Mhm.
We're going to see people die from COVID-19 at rates higher than what we've seen now, and it couldn't be more critical now. Now is the time where we have to maintain vigilance and make sure that we're still abiding by social distancing principles.
So also, going back to the normal before COVID-19, do you think that we'll ever get to that point again now that everything has happened and people are in this mindset of social distancing, not giving handshakes, not
Right.
hugging people when they greet them? Do you feel like it's possible to even go back to what we were doing before?
Yeah, I mean, I think there's things we'll learn from this. That we're going to learn an incredible amount of how we prepare for a pandemic. We're going to learn how socially connected we are and how fast a respiratory virus can transmit from person to person. So we are going to get back to life as we remember it. Absolutely. Businesses are going to be back open. We're going to be gathering with friends and family. We're going to be doing the things that we've done in the past, but it may take us a while. And there's a lot of things on the horizon that will change the trajectory of when we can do that.
Mhm.
Um, the having real time, very rapid tests, potentially a vaccine in 18 months, potentially therapeutics. Now we have serology tests to determine who has been infected and who hasn't. So many of those things will be coming online in the next 12 to 18 months that that's going to change how we react to this. It's going to change how we reopen government. Um, and so life will get back to normal, but everybody's going to remember this time. Everybody's going to remember, how easily viruses are transmitted, how dirty our hands are, how often we touch our face. Um, People are going to be living life through a different lens, that's for sure.
Yeah, it's been described as like a generation defining moment, which I
It
truly
is.
think that it is. Um, so we also just launched a new program today called Project Protect. It's a volunteer program to make medical grade masks, and we're asking the community to make 5 million masks in the next 5 weeks for our healthcare workers. And we've also asked for the donation of actual cloth face coverings as well. Can you describe the main differences between those medical grade masks and the
Yeah.
cloth face coverings?
First of all, what a collaboration, right, between Intermount, the University of Utah, and the Church of Latter-day Saints. I mean, just incredible collaboration of them coming together and serving our caregivers. And I mean, we couldn't be more proud at this point. There's a big distinction between medical grade masks and cloth face coverings. So, cloth face coverings is what the CDC and Utah Department of Health has recommended asymptomatic individuals that are in the community where when they go to places where it's hard to do social distancing. So let's
Mhm.
just take the example of a grocery store, for example. It's really hard to do social distance. People are in the store, there's food everywhere, etc. And so the point of a cloth face covering is to prevent the transmission of potential virus in somebody that doesn't have symptoms, but maybe pre-symptomatic or don't ever develop symptoms, is to prevent those viruses from coming out of their mouth and the nose into the environment. Okay, it's to protect that, to decrease that burden. So then when we do go in the grocery store and we pick up foods or whatever it might be, we're not picking up virus because that transmission has been blocked by a cloth face covering. These are masks you can make at home. There's lots of tutorials on how to do that. Contrast that with a mask that are healthcare providers use, so a medical grade mask. That medical grade mask does two things. One, it does the same thing and it prevents the transmission from potentially asymptomatic healthcare worker into the hospital environment, just like a cloth face covering does. But the other thing it does is it prevents transmission of the virus from an infected individual to that healthcare worker. So it protects that healthcare worker from getting infected from patients that are in the hospital, and also visitors that are in the hospital. And so it has twofold. It's really protecting the healthcare worker from getting infected in the healthcare environment where we know there's COVID patients, but it also prevents transmission from that healthcare worker out into the hospital environment. So a really important designation. Hospital grade face coverings or surgical mask, N95s, those got to remain in the hospital. We have to have a supply of those to protect our healthcare workers. If we don't protect our healthcare workers, there's going to be nobody in the hospital to care for these patients that are sick. And so that's got to be a priority for us. And then the community should really be focusing on wearing just homemade cloth face coverings.
Yeah, it feels like it could be this never-ending cycle if we're not giving our healthcare workers the proper PPE to actually use.
For sure.
To patch it, go back to work. We need to be really careful with that. Is there any final words that you wanted to kind of give to us about what's happened in the last week with COVID-19 and kind of where we stand?
Yeah, a lot's been happening. One is you've seen most likely that there's a big push and a big emphasis that if you have symptoms, get out and get tested. So there's lots of different places to get tested, from Intermountain sites to University of Utah sites to some state-run testing centers. It's really important from us from an epidemiology standpoint and a modeling standpoint to really understand what is the burden in our community. So if you have symptoms, and you need to have symptoms, we don't want asymptomatic patients showing up, but if you have symptoms, so fever, cough, shortness of breath, and now there's new symptoms we're learning about COVID-19. Inability to taste or smell is turning out to be a really prominent symptom of this infection. Muscle aches or myalgias, chills, and then even diarrhea in conjunction with fever and cough. If you have any of those symptoms, we want you to come get tested. We need to know what is the burden in our community. We've seen our testing numbers dip a little bit, and we really want to make sure that people that have symptoms get out and get tested. Okay, and so that's really important. That's one. And then the second is there's been a lot of news coverage about a new test, and that test is serology or an antibody test. So this is a blood test as compared to a test that you do in your nose to detect active virus. The blood test determines whether you've been infected previously with SARS-CoV-2 or the virus that causes COVID-19. That's a blood test. It's not in mass production right now. That is coming on board here in Utah, and we are putting pretty tight guide rails about who's going to get that test and how it's going to help us. And that test really just determines whether or not you've been infected in the past 4 months. It's yes or no. And that potentially has implication in terms of diagnosing an acute infection and also really understanding the epidemic as it stands, but not typically used for acute infection. So make sure we just make that distinction. Testing is available. We have plenty of tests in the state of Utah. We're actually one of the better states in terms of the amount of tests we have for our community. Just get out and use them if you have symptoms.
My last question too for you about the antibody test is, when will we know more that we can inform the public of how they get this test, who's qualifying for it? Do we have any information about that yet or not quite?
This test has just come on board this week up at the main testing center at ARUP. So it's a big testing center. And we have the capability of doing a couple hundred tests per day. We aren't up and running in terms of mass testing like we are with the nasal swabs, in which we can do 5,000 a day. We'll keep everybody updated on this medium in terms of when those are available and who should be getting those tests. That's the key point, and what you're going to do with that answer. The challenge that we're running into is that all this test says is whether or not you've been infected in the past. We don't know if that means that you can't get infected moving forward in the future. All it says to us is that, yes, you've been infected in the past with SARS-CoV-2, but it does not tell us that you are safe to go out in the community. It does not tell us that you are safe to interact with large people, groups of people, because you can't get the virus. And so we really need to learn more about what that test really means.
That's a really important distinction, that just because you get this test doesn't mean you can go back to normal, because it takes just one person who has it to keep the loop kind of going. So,
right.
Yeah.
Exactly.
Well, Eddie, thank you so much for joining us again today. We really
Mhm.
appreciate it. I'm going to put a couple phone numbers on the screen for you guys. The first one is that website for Project Protect. It's projectprotect.health. You can go to that site. There's a volunteer tab on that page, which you can click and find out how you can volunteer to get involved in making these medical grade masks. We also have our COVID hotline that you can call if you have questions about symptoms or getting tested. That number is 844-442-5224. And our last resource we want to share with you guys is our emotional health relief hotline. It's available 7 days a week from 10 a.m. to 10 p.m. And that number is 833-442-2211. Thank you all for joining us, and we'll talk to you next time.